Pomona Valley Hospital Medical Center in California has been working to reduce their total patient harm rate.
My name is Tracey Bennett. I'm the Director of Quality Management and Infection Control at Pomona Valley Hospital Medical Center. The best thing that's happened at Pomona in reducing harm is that our frontline staff have really begun to own the information. Previously, you'd get a dictate, or it was, okay, you guys are gonna stop doing this or start doing that. And I don't believe we really gave them the tools and the information to really understand why they were doing what they were doing. And so we really made an effort to make sure that the staff understood the impact to their patients, because everyone's there to do a good job and to take care of their patients. A lot of times, because we're all in that same workspace, we speak the same language, so we don't really try to find the right terminology or a way to make it really universal. And so that's why the harm across the board, the composite score, is such a big deal for us now, because labor and delivery, they focus on early elective deliveries, but they don't really have urinary tract infections. And so when we're siloed with our data, it makes it difficult for each area to relate with the other area. So then when we put it all together, now we're all on the same team, we're all focused on this score, and this is your part of the score, and this is your part of the score, but we're all working towards the same goal, so it's been great. One of the strategies I wanted to share at Pomona on how we incorporated our patient and family advisors into our groups. Our original plan was that we took a list of committees where we thought it was most appropriate for them to join, and the plan was that we would put the advisors on those committees. And as things evolved, instead of that, we changed our strategy and we educated our management teams on the roles of the patient and family advisors, and we requested they invite the advisors to their committees. And as one of our advisors had told us, the reception that they get is so welcoming, and it's really made them a part of the team, as opposed to us assigning people to the team. Them inviting them to the team has really made a difference, and it's really helped to build that teamwork.
The perspective I think I'm able to add as a patient-family advisor is to let them know that the patients do have a voice, and that a lot of, just from the perspective of the patients, how we're feeling, how we're treated, when you say something, how it's interpreted. Just making sure that, as lay people, we're talking the same terminology, especially when you're taking those surveys, so you can get more accurate reading of where you really need to go and improve. You may not even need to improve that. You may be doing that already, but if you're not doing speaking the same language in the same terms, you don't really know.
Hi, my name is Ray Ryback. I'm the risk manager and the manager of patient relations at Pomona Valley Hospital Medical Center in Pomona, California. In my work as the risk manager and the manager of patient relations, we do work in the area of disclosure and transparency. Unfortunately, when we do have patient harm that unfortunately happens from time to time, we do engage with our patients and families as directly as we can, and we have found that working with them, we learn things that we can then use and share with others within the organization. And we have had very specific harms that have resulted in very specific improvements across the board. And so we're hoping that having more direct engagements with our patients and families will improve our services even further.